Nadhim Zahawi is the Vaccines Minister and joins us now. Very good morning to you, Mr Zahawi. I mean, Johnny Vegas makes a very good point. Personal responsibility is all very well, but you can't combine common sense with alcohol, and that's one of the things that you're doing today.
So the guidelines are clear. And today, actually, the Minister for Business, Paul Scully, is working with industry, the nightclub industry and others to make sure they make best use of testing and the app certification as well, because we all want to get our lives back to normal as quickly as possible and do it in a safe way. This virus is highly infectious, aerosol transmitted. The guidelines are very clear that if you're in an indoor space, then and it's crowded, then you should wear a mask. The really important...
Sorry, can I just interrupt? The guidelines are not clear. Sorry, I have to take issue with that. You have got rid of the legal requirement to wear a mask in an enclosed space indoors, and you have turned it simply into guidance, which means that most people will just think, well, actually, I'm not required to wear a mask. Simply changing the language to expected doesn't make it a requirement.
So, Susanna, you're right. This is not government by diktat. It is government by asking both businesses to take corporate responsibility, and the supermarkets have demonstrated it. Transport for London, other transport systems, the metro mayors are demonstrating it. And of course, individuals are too. It is supported and expected. And it's right that we take that corporate responsibility and that personal responsibility. And it's the right of those businesses to do that. And of course, their customers then to respect it. That is, in my view, the best way to get back to normality as quickly as we can. It is the right thing that we are cautious. We're getting to step 4 because almost 88%, 87.9% of all adults have now had one jab of the vaccine and that protection. 68% of all adults had 2 vaccinations. We've met the deadline of offering the vaccine to all adults slightly early, ahead of today. By mid-September, all those 18-year-olds who are getting their first jab now will get their second jab. So there are no easy decisions, is really what I'm saying.
No, I don't think anybody would consider any of these decisions and the choices you're making to be easy. But, and I'm sure you know this, a group of international scientists from around the world have joined together with some UK scientists as well, describing the government's decision to lift all these restrictions from today as murderous. One of those scientists, Dr. William Heseltine, was speaking to our colleague Charlotte earlier on in the programme from America. Now, he's internationally recognised as a COVID expert. This is what he had to say about the lifting of restrictions in England today.
If I were to design a massive experiment to create a more dangerous virus, one that is capable of blasting through our vaccines, I would do what the UK is proposing to do.
So for all the success of the vaccine rollout, as you're rightly pointing out, and we can all be very proud of that, what he is saying there, an internationally renowned COVID expert, that despite all of that, we are putting together a position whereby the virus can work out how to circumnavigate those vaccines, can find a way around the vaccines and put us back to where we were.
So just to unpack that a little bit, when I took this job on, Ben, you remember back in end of November, we started vaccinating on the 8th of December with Margaret Keenan as the first person to get the Pfizer-BioNTech vaccine, and then 4th of January with Oxford AstraZeneca. I said at the time that 99% of mortality came from that first phase, the 1 to 9 groups that the Joint Committee, the experts like your expert here, said to us, protect those people because they're the ones who end up with severe infection, hospitalization, and sadly, in some cases, death. Now, all those people have come forward in very high numbers. In all those categories, the 1 to 9 is over 90% have come forward and got their vaccination and are now double vaccinated and protected. And of course, we will boost their defenses against the virus beginning early September. That's the operational plan. And of course, protect them against flu because we've had not much flu circulating in communities.
What Dr. Heseltine is saying, though, is that we are creating an environment whereby another variant can come about now, which will put them equally as vulnerable as they ever were when you managed to get them vaccinated originally.
I'm going to come to that, Ben, and just say a couple of things on that. One, the vaccines, the reason I described it to your viewers just now, is that wall of vaccinated communities does protect you against transmission of the virus, and more importantly, has weakened the link, severely weakened the link between infection rates and serious infection, hospitalization, and death. What the virus does is it mutates. It's mutated hundreds of thousands of times. We keep a very close eye on the virus of concern, as we're seeing in the beta variant that's prevalent. What's important to remember is we're not sort of saying, everything now goes away. Our border restrictions remain very stringent, with now over 60 countries on the red list, and of course amber and green list. And the guidelines are very clear in terms of...
Okay, but they're not regulations. Look, a vaccine is not the protection we hoped it was going to be. We know that it offers significant protection, but as we've seen from the Health Secretary, somebody who's double jabbed can still get COVID, and that affects all the people that they've been in contact with. Do you expect the public to continue following the rules on self-isolation when they have seen the Prime Minister and the Chancellor argue for 2.5 hours that it's absolutely fine, if you're part of some kind of pilot scheme, that you don't self-isolate? Because it occurred to me between 8 o'clock and 10:37 yesterday morning that you completely smashed public consent in the £37 billion test and trace system.
So, look, first of all, that pilot scheme, not just Number 10 and the Cabinet Office were participating in it, but organisations like Transport for London and Network Rail and Heathrow and others. We make thousands of decisions, Susanna, in government every week, every day. The Prime Minister looked at that and very quickly realised it was a mistake, it was a wrong thing.
Not quickly enough before Number 10 had put out a statement on it, and not quickly enough for one of your ministers to have to go on the airwaves yesterday and try and justify it. And I felt sorry for Robert Jenrick, because frankly, it was unjustifiable. It was a massive error, and the reason that you U-turned on it was because you realised the public were outraged that once again there was one rule for all of us and one rule for those at the top.
Well, as I said, look, this pilot scheme, it's worth reminding your viewers, it hasn't been going for a week or two. It's been going since December. And as I said, the Cabinet Office and Number 10 were participating in that pilot scheme. They no longer are. We make thousands of decisions, and of course, we don't get every decision right. This has been an extraordinarily challenging time. I can tell you from my work on vaccines, there are no easy decisions, Susanna, at all.
No,
right?
but what you did yesterday, Mr. Zahawi, with respect, what happened yesterday was that there are 500,000 people who get told to isolate because they've had some kind of contact, and in many cases they're not even sure who they've been in contact with. And I think a lot of those people would have looked at what the Prime Minister and the Chancellor did yesterday morning and thought, right, if it doesn't apply to them, why on earth should it apply to me? And public consent in your measures is really important. Do you admit that it was an error yesterday to give out that message?
Of course, and as I said, as soon as the Prime Minister realised that this would be wrong, he came out very clearly and said, we will self-isolate. That's the right thing to do. It's worth also remembering that today we've announced that for frontline healthcare staff and social care staff, if they are have come into contact with someone who has COVID and have had the notification to self-isolate, if they test negative with a PCR test, they don't have to. They can go back to work. And of course, by the 16th of August, all people who are double vaccinated, if they are notified that they've been in contact with someone with COVID, and if they test negative, they also can go back to work. So these are all...
that date could get brought forward, Nadhim Zahawi, the 16th of August, for people who have been double jabbed?
So the reason for the gap, Ben, is because we want to make sure we get more people double jabbed, especially some younger people who obviously every adult is now eligible because we've hit that target early, but getting younger parents, teachers, other professions double vaccinated so that we can make sure that look, this virus is highly infectious, aerosol transmitted, probably the most infectious in human history. We have to be careful. There are no easy decisions, what I'm really trying to say. And like the nation came together with a vaccination program, I think the nation will respond today and come together and be careful. I will be being careful in crowded space because I don't know if the next person sitting next to me may be immunocompromised or immunosuppressed. And it's right that I would wear my mask in a crowded indoor space.
All right. Nadhim Zahawi, Vaccines Minister, thanks very much indeed for joining us.